Okay.
Great. All right. Thank you all for being here today. We are going to get right started just so we can make sure, we value your time. We have a brief time today, to really go over what a needs assessment looks like. So we're just going to dive right in today.
Before we do, Milo, we should tell them who we are. They're
Absolutely.
wondering who are these talking heads.
Absolutely. Go for it, Ronnie.
I'm Ronni Katz. I'm the director of the New York City Prevention Resource Center, and we're really happy to be here today. What we're going to be presenting is an overall view of needs assessment, but we'll be asking you to please jump in there and apply it to your target audience and your target population. And any questions or experiences you want to share, we encourage you to do that. We want to make it as interactive as possible. And now I'm going to turn it over to Milo.
Great, thank you. Like Ronnie said, first of all, my name is Milo. I'm a community development specialist for the New York State Prevention Resource Center. Like Ronnie mentioned, we're going to give you kind of an overview today, but please feel free to ask questions, make any comments as it relates to your work. We're also going to have some time today to work in some breakout groups. So you'll get to know folks from other coalitions doing similar work and brainstorm some ideas about needs assessment strategies. So I'm going to start the PowerPoint. And again, if you can keep your camera on, that would be great. I know some folks may just not have a camera on their computer. And again, we understand that. So just to dive right in, we are going to be looking today at performing a community needs assessment. And of course, we are funded by our great friends at OASAS. And here are just our Prevention Resource Center goals. So as you all may know, we work to identify existing coalitions, to provide training and TA to foster the growth and sustainability of existing coalitions. We also do TA and training on the strategic prevention framework, like we are doing today with needs assessment. And then where there are no coalitions, we provide TA and training to foster the development of community coalitions. So just to jump right into it, why do we conduct a community needs assessment? Before I give you my ideas, would anybody like to share why they think we need to conduct a community needs assessment? Either shout it out or put it in the chat. Why do we do a needs assessment?
So that interventions are appropriate for the community.
Yes, great answer. And I'm going to see it in the chat as well. Focus of population. Yes, great answer. So we conduct a needs assessment because, first of all, it helps us create a focus for our prevention planning, right? So we don't really know what substance misuse issues or risk and protective factors we're going to address in our community until we've conducted the needs assessment, right? It would kind of just like be, kind of be like just throwing darts at a board randomly, right? Without any particular focus, without any particular aim. I want to make sure I see in the chat so we can work to address the specific populations, specific problems facing our populations. Absolutely, right? Like I just mentioned, we don't really know the problems until we've actually conducted the assessment. It can also help us mobilize our community. And this is kind of twofold. So first of all, it helps you understand the populations that are primarily affected so you can engage them in prevention work. It also can be, the needs assessment process can also be collaborative. You can work with your community, which we'll talk about a little bit later today. You can work with the community throughout the needs assessment process. And the data collection process can really be a, community building activity in some ways. You're going to have to, in a little bit, we'll talk about form partnerships to really collect your data, and to really get to understand the problems in the community. So it can be a way to, mobilize your community around a specific issue and also engage them in the process of collecting this data and building those partnerships for your coalition. It also helps us address misconceptions, right? So often we may live in the community that's affected. And so maybe we have ideas of what the substance misuse issues are, right? But until we can conduct that community assessment, we don't really know. We're kind of just making, our preconceived notions or assumptions about the issue, but we actually don't have the data to back that up. So by completing a thorough needs assessment, we're able to put factual data and information into our work, which helps eliminate those misconceptions and assumptions. Again, we need to understand the true landscape of our community, not just the preconceived ideas that we may have about it. And finally, it helps us establish the baseline data to evaluate progress. So again, the needs assessment is going to help us collect data to understand the baseline of our community that we can then use to evaluate our progress off of. When we're implementing different strategies to combat substance misuse in the community, we want to have that baseline data so we can show whether or not our strategies are effective. We could do all of this work, and without a baseline data to go off of, we won't be able to prove effectiveness at the end. And so these are just some of the essential steps of a community assessment, right? So first we start with the existing data. That's when we're also going to try to work with our community partners to get local archival data, right? We don't have to reinvent the wheel. There is data out there about, for example, hospital admissions, right? ER visits. We want to work with agencies like hospitals, law enforcement, community organizations, state agencies, and epidemiological work groups to get that existing archival data to see, again, what is our baseline of data that exists. Then we're going to look closely at the existing data, examine the quality of the data that you found, discard any data that is not useful, and then create an inventory of the data that we feel confident about including in our assessment. Again, that's when we're also going to need to really use our skills of discernment to figure out, is the data that we're looking at that exists, how much does it actually relate to the problem that we're looking for? Are there any populations that were not included in that data collection that we may need to address in our own surveys and focus groups? Then we're going to, again, identify those gaps to see what are the gaps in the existing data that's not there, and how can we as a coalition work to fill those gaps. And really essential to doing our assessment is to assess the risk and protective factors that exist in our community. So as any part of an assessment, we need to have a guiding question. And that guiding question has to be about what are the underlying conditions that must be considered in the community to address our problem of focus. And I think often we may just want to immediately address, we may want our question to be something like, well, how can we just solve this issue, right? How can we just completely stop, for example, underage drinking? How can we just completely stop substance misuse, right? But those questions are not ones that our assessment can help us answer, and they're not problems that our coalitions can really address head on. We can't address problems of substance misuse without first addressing the underlying conditions that are creating that problem in the community. And that's what we're going to talk about throughout this training, is how we address how we first identify those underlying conditions, those risk and protective factors, and then how we can use that data to help us figure out what we're going to do about it as a coalition. As much as we may want to just tackle an issue head on, we cannot address opioid misuse specifically, because I know that's what our grants that are bringing us here today focus on. We can't just address that without first understanding the underlying conditions that are leading to it. Does anybody have an example they'd like to give of a guiding question for their assessment that their coalition is working on?
Would addressing health disparities be one?
Yeah, that could be a question of like, how are we going to, address health disparities throughout our coalition work, or what health disparities exist in the community? That could be something that helps guide your assessment. Does anybody else have any other ideas?
So, Milo, it's not necessarily an idea, but just for clarification for prevention needs assessment, as you mentioned, what are the underlying risk and
Yes.
protective factors for substance use misuse prevention, right? And while health disparities definitely fall into that range, it's not necessarily something you'll be able to work on with this grant. So just keep that in mind. Thanks.
Thank you for the clarification, Barbara. All right.
Oh,
You
sorry, I was just going to jump in.
Sure.
I know that we're looking at access and community norms as well. So, attitudes favorable, to get to Barbara's point about sort of the risk and protective factors that we kind of look at through survey data and that sort of thing. So I know that those are big things for us in Greene County.
Great. Yeah, great example. Again, like was mentioned earlier, we're really trying to address the underlying conditions that are for this grant relating to opioid misuse, substance misuse broadly. So that needs to be the main focus. And then using that question, we'll figure out what are those risk and protective factors specifically, like you just mentioned about availability and access. All right. So this is really what we need to assess. So what we first assess is the nature and extent of substance use problems and related behaviors, right? So that's like the big first piece, is that we're looking at the specific problems and related behaviors, because that's how we're actually going to figure out the extent of the problem in our community, right? It can often be difficult to conduct a needs assessment and not without collecting this data, you're not really going to be able to understand what the problem is in your community, because you need to figure out the problems relating to the substance use and the related behaviors that come from that. So that's really going to help us see more of what the issue actually looks like in the community. Then we need to look at the risk and protective factors that influence these problems and behaviors, right? So these are the factors that are putting people at a higher risk or a lesser risk of substance misuse. And we'll go over that, I think, in 1 or 2 slides. Many of us are probably familiar with risk and protective factors, but we'll just go over it again for anybody that may be new to the work. And then another core piece is assessing the existing resources and readiness of the community to address its problems. So these are the resources that we are going to work with and maybe expand upon to address our problems and related behaviors and our risk and protective factors. We also want to know how ready our community is to address this problem. I believe that you've all already conducted community readiness assessments. So you may see that in some communities, it's going to be a bigger challenge to address the problem than others. And knowing that at the beginning will help you guide your strategies as the coalition goes along. And like we mentioned before, this is important because substance misuse problems and related behaviors cannot always be changed directly. So using the SPIF will focus instead on addressing those underlying risk and protective factors for the related problems and behaviors, right? So that's why it's really important that we're assessing these things, so that way we can figure out how we're going to address the underlying risk and protective factors. And I won't spend too much time on this because I do believe that many of us are familiar with the risk and protective factor framework, but we still include it just to make sure we're all on the same page. So, and this is directly from the SAPS training as well. So a risk factor, as defined, is any attribute, characteristic, or exposure that precedes and is associated with a higher likelihood of problematic outcomes. The outcome that we are focusing obviously on is substance misuse. Would anybody like to give an example of a risk factor for substance misuse broadly, or maybe opioid misuse specifically, since that's what we're focusing on for our grant? Would anybody like to give an example of a risk factor? I mean, someone said one earlier about access and availability. That's a community risk factor. Would anybody like to give other examples?
I could jump in and also say something like rental norms favorable, community norms favorable.
Absolutely.
In terms of risk factors, I think in terms of protective factors, I think in general, we as a field you tend to be a little light on including protective factors in our needs assessments. Like we kind of work from a deficit model in a lot of cases, but I do think it's important to include the protective factors. And so I think some of the key ones that are showing up in our data are like, at least for youth, social skills, commitment to school, which I think is actually more of sort of a almost a risk factor because commitment to school is kind of a low commitment to school is sort of a higher risk factor
Mhm.
these days with a lot of youth. So those are just a few things in sort of a just kind of spilling them out there, but that's kind of what we're looking at or thinking about.
No, those are great examples. Thank you, Dan. I'm also seeing in the chat perception. So like for an individual, low perception of harm, right? Then Dan also mentioned the family norms or family perceptions of harm. If a child's parents have a low perception of harm or have norms that are favorable towards use, that's a risk factor. I also see opioid RX use risk factor could be easy access in the home, right? Access and availability, both within the family, within the community. We'll go into the domains in a little bit. Not disposing of meds in the home. That's an interesting one. That one's really specific towards opioid use, but I know that's a lot of what the grant is trying to focus on. So that's a great one too. I also see mental health. That can be tricky. You need to be very specific. I know that the SAPS, the developmental framework, uses having depressive symptoms in a youth as a risk factor. These have changed a little bit over time, but we need to make sure we're specific. Pain, I also see as well. This one is a little bit more specific for opioid use, definitely. And this is when it gets more tricky of like how about when we talk about like pain management, prescription, prescribing trends in the community. Those are things we want to look at for sure. But for this, I think we need to focus really on some of the risk and protective factors that we know relate really specifically and broadly to substance misuse, which we have data to back. So that would be like things we've mentioned before, access and availability, norms favorable towards use, and things like pain, uh, prescription opioids, those would actually be more like the local conditions we're going to look at a little bit. But these are all some really great, ideas and things that we'll get to throughout the training. So I'm just going to show now kind of, this is looking instead now back at our problems and related behaviors. And so I think this is also from the SAPs. So this may be familiar to some of you that have done the SAPs before. So these are examples of problems and related behaviors. So on the left side, we look at alcohol. So some of the problems and related behaviors that we're going to see for alcohol are things like fetal alcohol syndrome and motor vehicle crashes. And then the behaviors that relate to those problems are women consuming alcohol during pregnancy and binge drinking, right? So then for opioids, we have problems like overdose, HIV rates, Hep C rates, and then behaviors related to that are using medications without a prescription or needle sharing. Would anybody else like to give examples of problems and behaviors, whether for substance misuse broadly or opioids specifically? In the chat, overdose deaths. Yep. Again, because these are some of the data points that we're going to be able to look at in our needs assessment that tell us the extent of the problem. And they're also trends that we can track over time. So things like overdose death rates related from opioid use, those are things that we can find data from in the community, and those are trends that we can track over time. Because we need to remember that these problems and related behaviors, those data points are going to help us understand exactly how substance misuse is affecting our community. They're also very specific and measurable, so we can track that change in the community. Without data on these problems and related behaviors, it can be difficult to determine the extent of the problem in the community, right? So without that data, we can't really understand the trends over time or the full extent of the problem. And I'm also seeing again in the chat, oh, no worries. um, so again, these data points are the ones that we're going to use to help us track trends over time and to figure out what this really looks like in the community. Did anybody else want to share before we move on? I know we're kind of buzzing through this morning.
I'll just say, and I'm sorry, I'm
No, just don't apologize.
going back to my old days of talking all the time.
It's okay.
I think a one that we and a lot of coalitions are working on that is interesting is Narcan training, nalox boxes,
Okay.
Narcan distribution, and the usage of those resources. So the number of Narcan kits that are going out. I know that that's not a direct one-to-one map
Yeah.
here, but the efforts of getting sort of that medication out into the community has been huge and has been I think a big contributor to success in communities that have successfully addressed or to some degree, to any degree, opioid misuse. So that's a big one, I think.
That's a really good point. And those, again, like relate to some of those local conditions that we can see in our community that may be helping or hurting the overall problem. So, low utilization of Narcan training may be a local condition that we need to address, right? If we're seeing that our data is showing us that there's a low utilization of those services, or maybe there's just low availability of those services. There are very few Narcan training organizations in the county or in the city, right? That's something that we can track and look at over time. It's something we can also work to improve because again, we want to look at these things that are very specific and measurable. Because like Barbara mentioned earlier, we need to have that specific measurable problem that the coalition can actually work to address. Because these more difficult problems like substance misuse overall or opioid use overall, those are things that we can't really those are just too broad. We need to get very specific about what we're trying to address. So things like low utilization of Narcan services, low availability of Narcan, and then also figuring out why, right? Why, let's say there is Narcan training available in the community, but we have a low utilization. We need to figure out why that is, right? Or maybe there is there's a high availability of Narcan in the county. Maybe our health department has a lot of Narcan available. Maybe our local organizations have Narcan available, but it's not being distributed to the community. That's where we want to figure out why that's happening as part of our assessment. And I see Ronni has her hand up. Go for it.
Thank you. Yeah, I had a clarification question about a comment in the chat from Jameson, and it said problem could be the arrest and incarceration rates related to opioid misuse. And I'm just trying to clarify, in what context are you referring to that as people who have been incarcerated and then are released and have a higher prevalence for overdose, or is it related to something else? If you could just clarify just for my own knowledge.
I mean, I see it all the time, like locally, people getting arrested and then or their house being invaded and there's tons of fentanyl in the home and that's why they're getting arrested because they have, opioids and fentanyl in the home. So I was just thinking like the correlation between arrests and, those getting arrested for opioids, and that's all I meant.
No, that's good. I wasn't sure. And then I guess in my mind, they even took it a step further to if they've been incarcerated for a while upon release, then they are at a greater risk for overdose as well because they haven't used. So I played the tape to the end, but thank you. That was great.
Yes, thank you for those points. Barbara, go for it.
Yeah, so now I remember what I wanted to say. Well, Ronni was talking, I had forgotten. So when you were talking about like Narcan availability and hypothetically maybe there's a storage of Narcan that's available by DOH or something like that. But one of the things you can pull out, and hopefully you can pull out from your community readiness assessment, is the community's level of acceptance for harm reduction, right? So this is a big issue in every county that people may not be ready to hear about. Narcan availability, syringe exchange, lock bags, things like that. So if the community's not ready for it, you're not going to be able to do the work that you need to do. So that's part of it, is working on building the community's understanding about the issue and educating them on this is really kind of around the harm reduction, right? So in other words, they need to be ready to hear the message. Otherwise, it's going to fall on deaf ears, and it might even, you might even get backlash, right? So it's not even like the community of people who are actively using or their caregivers, but it's the community in general. Like, if you really want to get that out there, you got to engage the community, and they have to be ready. So I'm hoping that you pull that out of your community readiness assessments, but definitely something to look at as to why things are not moving along the way they should be.
Absolutely.
Yes.
Yeah, great point. And that's again why that community readiness assessment is so important. Because like Barbara said, like we need to know the level of readiness in the community, the level of acceptability for harm reduction before we try to move forward with any strategies. All right. Great discussion, everybody. Thank you so much for your comments. I want to keep us going for the sake of time today so we can get to some of our activities. We've kind of already mentioned this a little bit. Some folks have mentioned this throughout their comments today, but we have to remember that risk and protective factors, they operate in different contexts. So we have the individual context. So that would be, for example, and again, a lot of this has been mentioned already, so I'll kind of buzz through it. And like an individual's perception of harm, right, relating to substance use, that would be an individual risk factor. Then maybe family risk factors, right? That's when we, like mentioned earlier, parental attitude favorable towards substance misuse. That could be a risk factor. School, low commitment to school. That's a risk factor again. And then community availability of substance, right? And I also want to make sure that I do make this point because I think so wrapping up the discussion, I forgot to mention it about protective factors is that protective factors, just one protective factor can help mitigate a big list of risk factors. Dan kind of mentioned this as well, is that we may not mention protective factors as much as we should because they are really important. Trying to identify those protective factors is very important so we can see, some of those assets that do exist in a youth's life in our community to better understand the full landscape of what's going on. So we don't want to discount protective factors at all. And again, like the biggest concern with risk and protective factors is that we are doing our needs assessment. We need to really understand that risk and protective factor, like we need to identify the specific ones in our community and not make assumptions about what they may be, right? So that's why the needs assessment is so important. So we can identify really what the risk factors are rather than presuming what they may be. So we need to collect data that will help us paint that detailed picture of the risk and protective factors in the community or lack thereof. And we need to see them in all contexts, right? We can't just focus on one context. We need to collect all data within all contexts so we can really see the full picture. And that will help us see what are those primary, risk and protective factors we need to identify and in what context they exist. All right, is there any other questions or comments before we move on? Because we're about to go into an activity now. I see we got some in the waiting room. All right. So we're going to do an activity. We're going to work in groups and they're going to be random. So you might be with folks you've never met before, or they're not in your coalition, and that's okay. So we're going to, in groups, this is where we're going to first start thinking about identifying partners to help collect data. And we'll talk about this throughout the training today. So in groups, we're going to make a list of at least 5 potential partners that we would want to work with throughout our needs assessment process, right? So that could, again, just examples, our local hospital systems, our PTAs, what are the partners that either exist actually in our community or that we want to build partnerships with to do the needs assessment. And so the question we really want to think about is how would these partners enhance your coalition's ability to collect important data on your target community? So I'll leave this up for a moment. I could also, once I take the slide down, copy and paste it in the chat, but we're just going to try to list some potential partners and think about why they're important.
And Milo, if I can also
Go for it.
remind everybody, just you want to have somebody taking notes, and it could be the same person or another, and somebody who's going to report out. So just when we come back, it'll be a short report out, but please expect to have somebody do that. So this way we don't have to volunteer you. Or what do they call that? There's a combination. Volunteer. Okay.
All right. All right. I'm going to take down the slide just so I can open the groups, and we'll do this. Okay, no problem. We are just going to do this for about 10 minutes. Does that sound okay, Ronni? And then we'll give you guys 10 minutes to share out.
Perfect. Yeah.
All right. So I am going to make 4 groups since we're kind of Just trying to see.
Yeah, FORx should work. And I know that Barbara should be included, and I don't know if Denise wants to be in a group or not.
You can keep me out.
Okay, it'll probably invite you, but just choose not to join.
Okay.
We're doing it automatically.
Yeah, I mean, I usually do it automatically.
You need me to do it?
No, I can do it. I was just trying to do it manually so I don't put people in groups that don't need to be in them. So just give me like 2 seconds while I finish this.
Okay, so just wait a moment. And any questions in the meantime about the task? All right, and please keep those cameras on, and especially in the breakout room, so people don't feel like they're talking to no one. And we can see on the thing who's on the chart whose camera's on and whose is off and who's speaking, who's not. So we will pop in.
Yes. All right. So groups are open, 10 minutes on the clock. Think I have it so they all just automatically go in. And all right, cool.
Says
Okay.
that the county might provide. We had school districts thought that that would be important because then you can get access to the youth perspective and what, I'm not sure what youth perceive as far as opioids. So to get their input, we thought the rest were pretty similar in that you can provide a baseline and then see where you're headed and what ongoing issues might be. And it's easy for us to have our assumptions of what's going on, but if we get feedback from other agencies and other places, we can kind of actually see what's going on in our community.
Great. Yeah, I think those are really great ideas, really great explanations of why. Again, like it's really important to have those connections so you can, first get the data that they already have, and then maybe, like, for example, do a focus group with students at the school or do key informant interviews with teachers at the school. So those relationships are really important. Great ideas, everyone. Who would like to go next? I saw Dan had wanted to go, and I think maybe somebody else. Feel free, don't be shy.
I can go.
Go for it.
Yeah. Our group discussed police departments, the Rotary clubs, local health department, pharmacists, and schools. We first introduced ourselves as far as our background and how we've been working in the communities, which was helpful for us to understand where we were coming from for, looking for this survey information or how we wanted to collect our data and our focus. So that was very helpful for us to begin that discussion. So we each decided to name something that we did look for in our community, and then we just had the discussion as to why these were beneficial. And it was wonderful feedback because I think that we all understood where we were coming from as far as perspective wise. So yeah, that's what we had for the 5.
Cool. And I'm seeing lots of, overlap so far. Police departments is coming up multiple times. And then, again, listen to the other group's responses. It could give you other ideas for your coalition. So great ideas. Let's keep going. Dan, go for it.
Yeah, so our group, a lot of the similar sort of groups and whys as the others, schools, hospitals, existing substance use prevention groups, also thinking about treatment and recovery there a bit, law enforcement and local businesses. We chose these largely because of the influence that these entities generally have in communities, the assets that they have and they can help bring to the cause, and the greatest potential for capacity building. And I think one piece of this that is very important is the existing groups that are already out there, because we talk so much about local conditions and identifying local conditions. And I think if there's any groups that have probably done that work and collected the data, it would be groups that have gone through grants or, efforts for prevention and substance use prior. So, in an effort to reduce redundancy and build on what is already out there, at least in my opinion, I think one of the most important ones is seeing what's already out there and happening.
Yeah, definitely. I mean, again, you want to see what's already been done in the community that can help, again, build that overall like community buy-in, maybe to collaborate with other groups that are doing similar work, learn best practices, and then even collaborate on data collection in the future. Really great ideas. I think we just have one more group that wants to go.
Yep.
And if you just want to share briefly, go for it.
I'll go ahead.
Yeah.
So like you said, ton of overlap. The
Mhm.
5 organizations that we chose were local school districts. We're looking to address youth concerns, and ideally the school has the greatest impact. Local hospital for data collection, recovery centers. We can get an idea of what demographics are being served, and what are the gaps in care. Local nonprofit organizations. To focus on unhoused populations, potentially get a realistic grasp as to what's going on, and then local government, so where they can help in filling gaps.
Yeah, great ideas. I mean, again, like talking about how we can work with the government to fill gaps. I like that you mentioned, trying to work with nonprofits that maybe are partnered or that work and serve on house populations. Some really great ideas here. And again, I think Ronni shared a resource in the chat as well that can give you more ideas. And definitely, in your groups, feel free to, like some folks mentioned earlier, get to know each other better and just, bounce ideas off each other. All right.
And I have a question too. How easy is it to access and utilize the prescription monitoring program in New York State? I worked for years in Maine where it was pretty easy for me because I had some really close contacts, but Maine has about 1.2 million people. So it was a lot easier to access, but how usable is it here in New York State? Does anybody know about that? Because it's something to think about. Because every state now has a prescription monitoring program. I was actually around when they first got developed, doing overdose prevention in Maine, and they're very helpful because they show you the trends of what's being prescribed in different areas, and they give you a lot of basic info. So that might be something to look into and see if you can possibly get some data from them as well. As we all know, it's so important to think outside the box when we're gathering data because since COVID especially, it's hard to get data. And we've all been finding that. So we've really been looking for new and additional ways to do it. So let's take a dive now into the basics. I know most of you, if not all of you, know about this, but it's just kind of a refresher. And if you have any new ideas, to please share them. Just as an example, we want to look at some risk factors that inhibit healthy youth development. And I believe we took this from the SAFs too. We take a lot from the SAFs. If you haven't taken the SAFs, we encourage you to take it because it really sheds a lot of light on prevention. And it's important to look at, risk factors across the domains or the different contexts. And this one happens to be the community context or domain, and how very often a risk factor with substance misuse can also, be reflected as a risk factor in other behaviors. And this is just a brief one to look at, just to get you in the mindset of thinking about this. But if you look, the problem behavior for substance misuse is also a problem behavior for things like delinquency and violence, and others will fill in the other columns in that chart as well. But that's something to think about across the spectrum to see how it's connected, because very often we don't think to look in other areas for data, but they're very much connected to what we're doing. And again, if there's any thoughts or ideas, please jump in there. Don't be shy. All right. So, if you did a strategy, just an example, that would impact low neighborhood attachment. You wouldn't only be impacting substance misuse, and as we said, but also delinquencies and violence in the community. So it might be helpful when you start to examine your own risk and protective factors for your community, and when you try to prioritize those risk and protective factors, how much can they influence across the board could be really helpful. And that's potential partners right there. We always look for new partners. Okay. Let's go to the next slide. Please, thank you. We've got 2 types of data. Anybody want to give us an idea of what quantitative data is before we give you the responses? What is quantitative data? Can someone tell us?
It's
Nope.
data that has specific numbers attached to it in some way.
Exactly. Thank you. Specific numbers. So it's based more around numbers. And if you have any other ideas, please feel free. You don't have to speak. Just put them in the chat if you want. Because we realize that sometimes, it's hard to speak, but it's easier to write it. So please, anything that you can think of. What else is quantitative data besides that, if you can think of anything else? Going once, going twice.
I have an idea.
I know. I do once.
Wait.
I'm like an auctioneer. I'm from New York City.
Yeah,
That's
right.
what we do.
Any unit of data that is discretely measurable.
Great. I love that. Really succinctly put and very, very, very well put. Thank you so much. And again, I feel like we're preaching to the choir here, as my Southern wife might say, preaching to the saved. But it's really important for us to hear from each other, because this is stuff and you can enlighten others as well. So thank you for sharing that. Let's take a look at what happens when we click the magic slide. Number data. Hey. How many? How often? All right. So what's the amount of overdoses? How often is it happening? And a lot of times, and we're going to look at examples in just a couple of minutes. But you know what? Let's take a look now, because I don't want to get them to kind of be mixed up. What are some examples of quantitative data? And you mentioned so many of them in the last activity. What would be some examples you can think of very quickly off the top of your head?
Number of overdoses.
Number of overdoses. That's right. Because you need to get a good assessment of the community. So if you know the number of overdoses, it's really important to use that and to have a baseline around that too. I worked, like I mentioned, I worked in Maine. I worked for the public health division for Portland, Maine. And very often we would look at the data, but it's also important to look at it in the context of, if you had a very low sample size and then it doubled, does that mean you've had a tremendous number of things? There were small towns in Maine that may have had, just at the time, like 2 overdoses. The next year they had 4. We had 50% more overdoses. But if, you've had 50 and next year you have 100, or you have 300 and next year you have 600. It's important to look at those contexts, because sample size is very important too when you're looking at quantitative data. Okay, what about qualitative? What is that? Thoughts? Any ideas?
Well, not number data, so things you would get from focus groups, observations, things like that.
Exactly, not numbers data. And I like to say the data tells the story. And as we know, funding is around data. We've got to know what's going on. It's data driven. You want to tell the story of that community, and you need both to tell the true story. One doesn't cut it. One is just numbers, but you've got to also put the flesh, the blood, the heart, the soul, the stories into it, and what people are seeing. I'll just give you a very brief example. We had a coalition in the Bronx, and the coordinator said, "Oh, we've got to focus on K2 and powdered alcohol." They're like, "Okay." Well, apparently he was seeing that in one of the buildings that he lived near, but there was nothing to prove it when we spoke to people. And we found out, and we looked at the quantitative first and then the qualitative, and I'd never even heard of powdered alcohol until then. That was a new one, but there were like 1 or 2 cases when there were so many more of, other factors that happen in other type of data. All right, let's see what they say about qualitative data. We want to tell that story. Word data. Why not? Why is this happening? Let's talk to people. Let's find out. What does this all mean? Really important to look at all of those. And I love that. I like to think of it as vibes. Yeah, what are the vibes in the community? What's happening? You're filling in the blanks between those numbers. You're giving it a real soul. You're giving it vibes. And again, the data tells the story. And if you can have some type of qualitative or reasoning behind the word, why? What does it mean? Coming from real people, that makes a difference. All right, let's go on to the next slide, please. And that next slide, okay. And let's look at the different way. If conducting quantitative market research data is important, and you're going to find out that things like surveys, questionnaires, polls, that's going to give you your basic quantitative data. And again, very often surveys are hard to find locally, so we have to go to the national level, we have to go to the state level, but we have to utilize what we can find in there. Anything else that would be quantitative that is missing from this that you can think of? And I heard you guys mention it after the activity. What about the archival data from, existing organizations or departments? Very often treatment data, police reports, and that doesn't necessarily fall into this realm, but you want those numbers so you can start to really look at it and see where it's happening, how often is it compared to last year, and get those numbers so you can really get a good perspective of the problem. All right, why don't we go to the next one? All right. Survey data could be tough to analyze because sometimes things can skew it. And again, looking at the amount of responses you've gotten is really important. A small sample size doesn't really give you an idea, but you want to get an overall sense of what is the data showing? What is the trend here? How is it happening over time? Has it gotten worse? Has it stayed the same? Has it gotten better? How does the data compare with other states, with communities, with schools? When you don't have local data available, sometimes you can find data from another community or another state with the similar demographics to yours. That helps. That'll at least give you a basis for comparison. And when you look at the data, what are the questions that are coming out of that data? What are the data gaps? What are you missing? These are all things that we looked at. What conclusions can be drawn? You need to answer these questions to help determine your problems. If you don't, you're not going to get a real specific overview of those problems. Any thoughts about these areas? Have we left anything out? Is there something you think needs to be asked beyond what we're saying at this point about analyzing? And Barbara has her hand up. Go, Barbara.
Thanks, Ronni. So it's not necessarily an addition, but when I hear you talk about this and the expectation we have for the coalition and their subcommittees and looking at data, this is an opportunity to really engage with your PRC, right? Because your PRC can talk you through some of these things and train the coalition on how to look at data through various trainings. So totally rely on your PRC to help get the coalition ready to start looking at data. So it's not all on you because it's a lot. So if you're not accustomed to it, it can be a lot to think about. All right, I have to make sense of this. And then the other part is this is a well-funded initiative. So you should have your data analyst who is, looking at this stuff and providing information about what it means. But your PRC is super helpful. So
thank you for that shameless plug. And we appreciate it. But also, I think it's really important. Barbara made a great point. We have so many situations where the coordinator and or the data analyst are carrying the whole load here for this. And it's important if the coalition is going to have buy-in, they want to be part of this process. So it can't hurt to have maybe at a meeting to put aside time to teach them about how to look at data, how to analyze it, getting your PRC to help you learn how to implement that activity. The more involvement you have, the more buy-in you're going to have, the more your coalition will have an impact on your community. Because I always say, if it's just the coordinator doing it all, you don't have a coalition. You have a coordinator doing it and reporting back to unconnected people. So you want to get them involved. And again, if you haven't taken the SAPs, please take the SAPs because this stuff gets covered and you get to practice it. Okay, any thoughts, questions before we move to the next slide? Okay, and by the way, if you need to take a break, please feel free, just do your thing. Because we didn't want to put in any breaks because we wanted to make sure we got through everything. But if you got to do what you got to do, take it. And also we talk about the 20-20-20 policy. Every 20 minutes for 20 seconds, look at something 20 feet away, just to give your eyes a break. All right, next slide, please. All right, using archival indicator data. This is tough because we've been having a lot of trouble getting, up-to-date data these years, over the last 4 or 5 years. Basically, you don't want data older than 3 years, for a baseline at least, because if it's older, it just might not accurately show you what the trends are for the data you're collecting today. So you try to keep it within 3 years, and if it's older than 3 years, 3 to 5 would be the suggested. Archival data is best when at the lowest level, like such as zip code or school district level or county starts to take it to the next higher level, but the lowest level you can get is the most effective, but you get what you can. And you want to look and make sure that the data that we said was in the last 3 years, you want to continue to examine data as far back as you can. So you can do some comparisons. So you could see the way the trend has developed over time within the data points you're examining. Because as we know, they've really got to match. If they don't match and you're looking at something completely different, you're not going to have a correlation. So, looking no older than 3 to 5 years, you can find at the national, state, and local levels. And again, we talked about the comparisons that can be made to see what community XYZ does in another state, perhaps with similar demographics, or how your community compares to a similar county or town within New York State and as the state as a whole. It'll give you an idea to see where you stand. And you want to look and see over time, is it increasing or is it decreasing? What's happened over the last 3 to 5 years? What happened before that? Where did we stand? And you want to zero in and look at the lowest level that you can. Again, school, zip code, etc. And that's the challenge, finding the data at that level. Is everybody finding it challenging to find that local data that we talk about?
What does lowest level mean? You're talking about as local as possible?
As local as possible. Yeah.
Got it. Thank you.
Yeah, because very often the data, like the YRBS, over the last year or two, they stopped really focusing on like in New York City, we used to get borough-wide data and even district, and now we're not able to. They're doing it on a much greater scale, so we're not getting a true picture. Because in New York City, our neighborhoods are so vastly different, and our zip codes are so vastly different, and we don't really have a basic comparison to the state or city level data that we used to get from the YRBS. And another thing that we look at a lot is intersectionality. How does it intersect with other data points and other populations and subcultures? Because we have a coalition, for example, that is focused on the intersection between homeless youth and substance use. Very often we look at data and it's got male, female, and race, and maybe age group if we're lucky. Taking it down and going further into the subcultures will give you a better idea of really where it's happening and where the magnitude is the greatest. Very often we have people and cultures and populations fall between the cracks because we never look at them. So you want to drill down as far as you can to get a true picture of that. There may be a community that is being affected that doesn't even show up on your data if you don't. So, and we do a training in intersectionality, which we will make sure that you all get invited to the next time we do it, because it really drills down for you and it lets you take a really good look. All right, any thoughts, questions before we move on to the next slide? Okay, let's go to the next one. So there's our archival data. And you've got your member organizations. They don't just come to be a part of a fun experience. They got to bring something to the table. And you want to get data from them. It's really important to invite member organizations or agencies or departments that can bring something to the table. Of course, you want people who are really interested in your mission, but you also want people to come who are going to bring something that will help guide your needs assessment and everything thereafter. So they can bring either qualitative or quantitative, doesn't have to be one or the other. Service data, like what are the services being offered and how often, where, to whom, whatever they have at that point. Any kind of demographic data, resources they're aware of. Because as we know in a needs assessment, we're not just looking at data, we're not just looking at things that affect risk factors, we're looking at things that affect protective factors too. When we do a community scan, when we train our coordinators to do it, we have them looking at the risk factors as well as the protective factors. And that's all part of the needs assessment. That has just as important a place as the risk factors. So I think it's natural to focus on the risk factors, but when we start building up those protective factors, the risk factors tend to go down. So it's really important to represent them. Anything else I'm leaving out here? So please feel free to let me know. Okay, we'll go to the next slide. And again, I know you know a lot of the stuff, you've been doing the work, but we're just trying to kind of refresh it. So we look at qualitative data collection tools. Here are some examples. This is not an exhaustive list, but online forums, various groups. Groups could be in person, they could be online, they could be, part of social media, in-depth interviews. And we're going to get more specific in the next part of this. Web survey chat and online communities. Do many of you use online, virtual, or social media to gather your data? I'm curious. Anybody utilize that?
Yeah, we definitely use like Instagram engagement as a form of data, like how many people reached by a certain post kind of thing.
Yeah, I think, that's really relevant because you start to see what people really are into. What are the posts that people want to look at? We work with a group called NYC POP, Partners in Prevention, and we've noticed with them, and we pointed this out to them, there's a certain type of design even of posts that people tend to look at. If it's a lot of words, they don't look, but if there's a photograph, boom, people look. If there's a video, people look. So it's really important to be intentional in how you design those things because you're going to get a lot more interaction. And people might share those as well. I don't share a lot of videos. I tend to share posts mostly in my own personal stuff, but I had shared a video a while back about transphobia on Instagram, and it was somebody else's. And for the first time ever in all my history of being on social media, I got almost 3,000 shares and likes, and I've never gotten that. It was somebody else's. I didn't take credit for it, but it was a really compelling post, and it went all over the place. That was, I think, my pinnacle. I don't know if I'll repeat that again, but I realized that it's really important to be able to share things that are publicly accessible and that people really enjoy or are going to be interested in. There was a lot of talk around it at the time, and it just was relevant. Okay, just keeping an open mind about what you can do in social media is really important. You could do polls, you could do chats, you could do a whole bunch of things on social media where you can get a lot of good data. And we try to do that. Those polls and those surveys are pretty easy to do. We encourage our coalitions to have presence on every possible social media platform and to put up polls and to put up questions and get people to answer them. And we just have been encouraging people now to really involve Blue Sky because a lot of people are joining. It's a great opportunity. Don't miss out on it. All right. I think this is where Milo steps in. Am I correct, Milo?
Yes, it is. Thank you,
Okay.
Ronni. All right, so now we're going to kind of go through some of the more traditional forms of qualitative data collection. So first, we're going to talk about focus groups. Has anybody ever done a focus group before? How familiar are we with focus groups? New, yeah, yes, no, a little bit new, learning about them still. I mean, that's okay because we're going to talk a little bit today about what they are, how they can be utilized in your needs assessment process, and how to really structure them so they're meaningful. Because I know that sometimes, yeah, have participated, not conducted. Yeah, I mean, again, participating in a focus group can kind of give you the other perspective of like what they're like as a participant, which is good to know when you're going to conduct them. Learning about them, you're planning to conduct them. Great. All right, so this is definitely relevant for you all because you're planning to do some. So what is a focus group? So focus groups are typically small, structured group discussions, but keyword on the structured, they can help us collect important data about substance misuse that may be difficult to collect through just like a survey, right? Again, qualitative data gives us that information that maybe we're not able to get through a survey alone, that we're not able to quantify, right? But that we can learn more about the why this is happening. What does it really look like to a community member? Focus groups can also help us get a better idea of attitudes about substance misuse among different populations, right? So you can really learn more from, for example, parents. What are parents' attitudes in your community about substance misuse? What do they really think in their own words, right? I think that in their own words piece is also crucial when we're thinking about, the utility of focus groups. You also, again, also in general, you're going to ask participants more open-ended questions and give them time to respond. You want the question, this is like, it's hard to strike that perfect balance of you want open-ended questions that allow participants to share freely and, in their words, what they think. You don't want to, make people feel like they have to answer a certain way. But you also want to have other probing questions prepared. That way you can kind of pivot when needed in a focus group. It can take a lot of preparation to really do one effectively, but having those open-ended questions in mind and then having some more probing questions prepared as well. Like, for example, let's say you are doing a parent focus group and you want to learn about substance misuse perceptions broadly, right? And then let's say you can have questions prepared if folks do bring up opioids in particular, right? You don't want to force them to answer one way or another, but you can have other questions, other probing questions in mind to add if folks do answer a certain way. If folks do bring up opioids, you can have more questions prepared that really help you understand their perceptions of opioids in particular. You also want to make sure that so focus groups are really helpful because the participants that are chosen are to represent a larger group of people about whom you want more information, right? So if you're trying to get information about a specific population, you're going to invite people that are part of that population because it's going to be difficult to, do a focus group with all of the parents in the entire school district, right? But we could start with, members of the PTA or parents who are able to attend within a school district. That's why it's really important to be strategic about who's invited. And we'll go on the next slide about why. But let's say you are trying to learn about opioid misuse within Indigenous youth, right? You're going to only invite Indigenous youth to that focus group because that's the population we're trying to get more information about. Or let's say we are trying to learn more about parents in a specific school. We're only going to invite parents from that school because otherwise we're not getting the data on the population we're really trying to target. And that's the big difference between a focus group and a listening session. So focus groups are focused and purposeful, right? Participants are recruited. They are, again, meant to represent a larger population about whom you want information. So you want to make sure that you're recruiting people that represent that population. It's not, a listening session is way less formal. There's no formal recruitment. Anybody in the county, the city, the school district is invited, no matter what population they represent. You want a very standard structure and questions because, again, you want to be able to use this data, right? You want it to be useful for you. Listening sessions are a lot broader. There's open floor for discussion. There is some use to them, but not in the way that we're going to use a focus group for our qualitative data assessment. We'll get into listening sessions a little bit later at the end of this training because we don't want to discount them entirely, but they're not going to give us the data that we're looking for that could actually be very useful for our assessment when it comes to learning about specific populations. Focus groups also help us look for emerging themes. They help us identify themes among participants. And we're going to have a moderator or a facilitator that leads the focus group. Whereas, again, the listening session is a lot more of an open forum, almost like a town hall sometimes. And we're going to, at the end of our focus group, create a report of results. And we'll get into that, I think, before we move on to our next type of qualitative data collection method. But we're going to have a report of our focus group. Whereas listening sessions, they're so open that we may not even have any themes that we can really report on, right? Again, we don't want to discount them entirely, but we want to be very strategic about how we're using focus groups, right? So we need to make sure they are focused, that they are purposeful, and that they are structured. All right. So here are some reasons to use focus groups. So they explore people's perceptions in greater depth than surveys alone can do. They also allow participants to add their perspectives, which may not be able to be done in other forms of data collection. It also, again, this is like a live thing. It's happening in real time, whereas a survey, for a focus group, there's a facilitator present who can clarify responses. Maybe a word is used that people are not familiar with. The facilitator can clarify what that means, right? Some people may not know what substance misuse is. A facilitator is there to explain what it is, so they know what they're answering. And also, again, asking those probing questions is so important. It can also be less expensive to do than surveys. Surveys can be very expensive sometimes to conduct. Focus groups, you can work with a group that already exists, again, like a PTA, like a youth after-school program, like a program at a partnering nonprofit that works with unhoused youth, right? So often it can be a little bit less expensive to conduct. And this is also what I think is important, focus groups can give us some quotations that public and policymakers can understand, right? So again, it's really important that we're letting community members say in their own words how they think this problem is affecting them, what they think the problem is. And those pullout quotes can be really powerful when we're going to lawmakers, when we're talking with community leaders, right? Because focus groups really give us that understanding of what people think in their own words about an issue. And then we need to, when we're conducting a focus group, identify questions. So again, the questions that we ask are really important because we want it to be done in a structured and scientific way so we can really use this data in our assessment and have it actually be helpful for us. So first, we need to think about what issues we're focusing on. We need to determine what our focus will be, and that will be helpful. That will be helpful in our data collection process because again, it'll give us very specific data. So for example, if you are seeing a high number of youth experiencing opioid overdoses, it might be interesting to do focus groups with emergency medical professionals to determine where and how often this is occurring and if they're noticing any trends. You could also do a focus group with youth to determine why they think youth are misusing opioids, or see if they even have a perception of opioid use within their peer group. You want to identify the questions first. The questions will guide who you want to recruit, right? So again, you need to be really specific about the population you're targeting and what you want to ask them. Once you figure that out, then you can start your recruitment. You also want to do this with a small number of core questions. And then again, from those core questions, you can ask probing questions later on if the conversation guides it that way. You want it to not run more than 90 minutes. Again, you want people to want to attend. You also want to make it easy for participants to participate and, it'll also just be easier when you're like analyzing the data, because if you have to analyze like 3 hours of a focus group, it's going to be a lot, a lot. And again, broad, open-ended questions. So folks can really respond how they see fit, and they're not feeling like you're trying to elicit a specific response from them. And again, the questions that we have will help us figure out who we need to recruit, and being very targeted with our questions, right? Again, it can be challenging to create questions that are broad enough that folks feel like they can respond how they see fit, and also making sure that they're structured so that you are collecting the data or trying to collect the data that you really need for your assessment. And then analyzing the data. Analyzing the data, again, that's why we need to be very strategic about who we invite, how we phrase our questions, what questions we choose, and, again, making sure that we are being very targeted. So, because we're going to analyze this data to actually use it in the assessment. So we need to identify the overall impressions of the focus group, right? What were the overall impressions we got from participants? We need to identify recurring themes for each question, right? Those themes, those key words, is really going to help us code our responses. We also want to identify quotes, right? Those are important for if we want to take this information to lawmakers. Oh, sorry. Oh, sorry, I wasn't sure if someone was trying to talk. Okay, cool. Oh, I want to make sure I have folks. Oh, and always a good idea to have your target audience review your questions. Yes, that is a really good point. That's why, for example, working with your youth coalition to create the questions for youth. Something that I bring up a lot is that we need to make sure we're using language that our population is familiar with. So folks might not know what an opioid is. Being very strategic about how you explain the substances, right? Like that's something that is really, really important because we want to make sure that our participants are understanding what we're saying. We want to make sure that our questions are culturally responsive to our population. So they're going to be questions that actually make sense for them. And having members of that population involved in reviewing the questions can be really helpful. That can just help save us a lot of time down the road, help your facilitator out for your focus group as well. We also want to see how do our responses support or contradict other data that's been collected. Again, this is what's great about focus groups is you may be getting data that you weren't getting from your surveys, right? And then you have to figure out, why those discrepancies might exist. And then we want to produce a report that links to previous data we've collected. Again, we're trying to tell a story with our needs assessment, right? And we need to let the data tell us that story itself. So we need to figure out how it's going to fit into the overall picture of our assessment. I want to make sure I look at the chat. Nothing about us without us. Thank you, Ronni. All right, does anybody have any questions or comments about focus groups before we move on? All right, I'm seeing thumbs up. All right, so I'm going to pass it over to Ronni now.
Yes, and I'm sorry for speaking really fast, but we want to make sure we get this all in for you. And again, these slides will be shared. And now we're going to look at key informant interviews. And this is the last collection method we're going to be looking at, but they're really important because you're getting to have a one-on-one conversation with somebody. So let's, again, quickly go through it. But if you have questions or comments, please jump in or put it in the chat. Next slide, please. All right. KIIs or key informant interviews. They're basically, as you can see, structured conversation with people of specialized knowledge about the topic you wish to understand. I mean, they have an idea of what's going on. They may be from a community level. They may be the people who are on different departments or more of a bureaucratic level, but people who know about the topic. They engage with the community in certain ways, different ways. And you want to try to interview many different key informants. I mean, some of the ones that we often see are, well, I'm not going to give you the answer. I'm going to see who would you interview? Who would have a really good idea about the problem in the community that you think you might be able to potentially interview? If you put them in the chat, and I'll help you fill in the gaps. Youth, absolutely. Who else? Parents, schools, public health. Yeah, these are all important. Police, teachers, our local opioid drug court coordinator. Yeah, one that doesn't come up a lot. That's a great idea. Any others? Well, I think you've hit the topics that we know. Pharmacists, ER staff, elders. Yeah. There's a lot there. These are all people who would be part of this. Somebody who's works in a youth program or a community agency or CBO. But you've pretty much hit a lot of them. And there are others you might think of along the way. Political leaders. Again, there are some political leaders who really are part of community and they delve into it and they get to know what people think about. And it's really important. I love key informant interviews because you really get to ask the questions. And very often with a focus group, you're not going to hear the same information because you stick to a script. But with key informant interviews, sometimes you can change that around depending upon who you're speaking to. All right, let's see that next slide, please. And here's reasons to use key informant interviews. So you want to look at specialized systems or processes, like the juvenile justice system. Where can you better find out what's going on there than from somebody who's a part of it? And that could be somebody who works in it, somebody who's within it, a youth who's part of the system, and has been within that system, there's a lot of different areas and aspects. It helps to identify your target population or issues you want to further investigate. Things may come up you didn't think of, and it'll give you another stream or food for thought to continue to look at it even further. And a lot of times, cultural barriers make surveys and focus groups difficult. This helps you refine your data collection efforts because you're zeroing in and you're going to the source. And it's really important to be able to look at that. Sometimes cultural barriers might inhibit surveys from being collected. Like if you have a large number of your community that doesn't have access to a computer or a phone, or students who are homeschooled, you're not going to hear from them at all. Very often we'll hear about surveys that are conducted over a landline. This happened a lot. This was probably the first time in recent history that I noticed that they were doing a lot of surveys with cell phones, because often they were leaving out big chunks. These were polls before the election recently. In previous years, they did it mostly with landlines, and they were getting big chunks of target populations who weren't being represented. You want to look at all of that. Again, we're looking at intersectionality, who falls between those cracks that you could talk to. It's really important to look at all of those when you're doing key informant interviews. And they can help you pinpoint a deeper level of data that you might not even have been aware of, as we mentioned before. So it's very, very important to be able to do those interviews and do them effectively. And we have groups that will say, well, I did 2 of them. That's not enough. For me, I like to do at least 10 key informant interviews. And Barbara, I see is give it a thumbs up there. So it's really important to be able to look at that. But get a diverse group. You don't want to stick to the same old safe choices. You want to find out as much as possible. This is where you can really get creative. All right, the next slide, please. All right, here's some advantages. Inexpensive. Hey, all it costs is your time or the time, and it doesn't have to be you. It could be your coalition members. We were working with a coalition a while back where the members were volunteering to conduct these interviews, depending upon where they had connections or where they were comfortable. And they conducted them. It doesn't have to be the data coordinator. It doesn't have to be the coalition coordinator. It provides readily understandable information and quotations for reports. You could use some of those quotes. You're telling that story now. Using those quotes is really helpful. And the person may not want to be identified by name, but you can certainly use their quote, get the permission to use the quote without revealing who they are. And it's flexible. You can add or you can omit different questions during the interview. You can ask clarifying questions, and you can delve deeper with the focus group. You're pretty much limited to, staying within the realm of what was designed, because you don't want to influence those responses at all. And they're not limited by time limits or question processes. It's really, a win-win. And you can even meet somebody for coffee, and that could become a key informant interview. It doesn't necessarily have to be this formal thing. So think of safe, creative ways to do it, not threatening to the person you're talking to, and you'll be able to come up with a lot of good ideas. All right, let's look at the next slide, please. Okay, now you want to analyze that information. So basically, you're going to look at all the responses and you come up with a spreadsheet. I don't know, it depends upon how you like to do it, but you want to have a written summary or an overview of what you found out. You also want to compare and contrast what informants told you. Again, it goes back to the powdered alcohol in K2. Well, only one person told me they saw that, but the other 9 didn't. So it really isn't relevant in the community right now. You want to identify recurring themes. And you're going to see those if you speak with the people who really have their pulse on the community. And then you want to link those themes to your surveys and or your archival data that you collected, because eventually you're going to see that some of those themes are going to connect. And that's where it will emerge what those real issues are. Because all of this data that you're collecting, it will give you a true idea of what's going on in the community. And again, key informant interviews, we mentioned a few, they have advantages at times over focus groups. And it's just a really, really good to find out information. And I wouldn't wait to write that summary or overview of the results. After you conduct that interview, write down that summary, get the overview on paper, or on your computer, or on your phone or your tablet, so that you don't forget anything. And then you want to compare that with what other informants have told you. And again, for the purpose of identifying recurring themes or possibly even things you didn't think of. All right. Any questions or thoughts before we go on? We're going to do a quick activity again. All right, let's go to the next slide. Here's what we'd like to do. We're going to divide you up into random groups again. And we want you to think about who in your community might have some information that could help your prevention efforts. And just think broad, think wide. Who would that person be? What information might this person have that could help your prevention efforts? And what 2 questions would you ask to elicit this information? We're just asking for 2. You're going to have a lot more when you do your actual interview. But just for the purpose of this exercise, we want you to identify just a person. It doesn't have to be by name. It could be by role. What information they could possibly have that could help your prevention efforts. And what are the 2 questions that you definitely would want to ask to find out about this information? So any questions about what we're asking you to do? All right, and we'll make sure to copy and paste that into the chat. Well, if we do it once they're in the rooms, they can see it, right?
No.
Oh, so we have to do it here now.
Unfortunate. Yeah, I'm trying to do that right now. Just give me a second.
Okay.
How much time? I was thinking maybe we do 8 minutes this time, just for the sake of time.
I was thinking the same thing.
Perfect. All right. Copy and paste of questions coming into the chat right now. And again, if you're not able to get all this down, don't worry about it. We know you have a brief time. Again, select someone to share out so we can, have a brief discussion when we come back.
Okay. All right, we're letting everybody come back in, and we want to make sure we get everything in. So we had 4 groups. Let's see how many we can go through quickly, and we'll just hear what people had to say. So can we get some volunteers to report out on those questions?
I can jump in.
Oh, please do. Thank you.
Sure. So in the interest of time, we talked about 6 groups, and I think we probably could have listed a bunch more. Some of these are specific to the efforts for the specific folks and their coalition, so it might not be universal, but youth, school staff, these are the groups that we would like to get information from and ask key questions. So school staff, teachers, SROs, superintendents, law enforcement, faith-based, libraries and other community organizations, and then people in recovery or people, I think, sort of with lived experience more generally in substance misuse and sort of the continuum of care. And a few questions that we thought would be, or paths of questions that we thought would be really helpful. One, for the folks who, especially like in schools, those sorts of settings, what policies related to substance misuse and opioid misuse are in place? Are they being implemented? So like Kelly said, in our breakout group, just because a policy is in place doesn't mean that it's implemented, and just because it's implemented doesn't mean it's done so with fidelity. And even if it's done with fidelity, doesn't mean that it's actually, doing anything good. So, getting to the nitty-gritty of what's in place and what's, how things are working. Again, trying to reduce the redundancy of effort and just filling gaps and improve processes. And then the last bit here, something that I think is very important to talk with all of these groups about is the sense of stigma in the community related to folks who have substance misuse issues, because I think that really gets to a very basic level of community readiness. It kind of goes right along with community readiness, because if everybody thinks that, those people, we don't want to deal with those people, and we hear this all the time in this work, your community's probably not ready for that kind of change. So that's what we came up with.
Those are great. And, the whole NIMBY, not in my backyard, with the stigma thing. I'll be honest with you, I'm a person in long-term recovery, and I was working in Portland, Maine, trying to set up one of the first recovery community centers. And we had a potential site, and a guy said, I don't want those people here. I don't want them to do violent things. And yeah, and this was a recovery center. And he started citing examples. And I looked at him, I said, those people? You mean people like me? Um, we didn't take that place, but the stigma, it's huge and it still exists in many, many ways. And it may continue to even get worse at this point. Hopefully not, but I think those are great questions. And it's important to bring those up with key stakeholders too, to let them reflect on that. So thank you so much. That was great. We're going to take one more for, because of time, and we want to make sure we can cover everything. So could we get one more volunteer, please?
I can go.
Go for it.
We chose a housing project, the subsidized housing in the area, and we also chose a person in recovery, who is a community champion. For the housing project, we wanted to ask them what their perception in the community towards harm reduction, and if there was any services local. Were they open to harm reduction, how folks were living in that community there. And for the person in recovery who was a community champion, what substances were being used in the community, were they experiencing stigma? Were people open to having services in the area, were there lack of services due to stigma?
Those are great. And we're starting to hear that recurring theme here, the whole thing about stigma too. And that needs to be addressed. I'm glad you both brought that up, but great idea for who to, recruit to talk about this with. So these were great. Thank you, everybody. I apologize for not being able to go over the other two, but if we have time at the end, we could always circle back around. So I'm going to turn it back over to Milo.
Great, thank you, Ronni. All right. We're just going to briefly talk about community engagement via assessment. And again, like what you've been mentioning, like the data collection process is a collaborative process, and thinking of ways where we can creatively collect data that involves our community could really build that overall community readiness that we need. So just some really brief examples, because again, we want to be conscious of time today. We will not keep you past 11, but just some examples, community engagement. These are all community participatory action research strategies that can be used to involve your community in the needs assessment process. So community scans, that's a way where we can really get a idea of the physical landscape of the community. The way that we do it with our coalitions is we have them go out and count the number of hospitals in a few block radius. We look at the number of libraries, homeless shelters, etc., to get an idea of like the physical assets in the community and where they're located. This can just be good as like a resource assessment tool. It can also be good as a way to help you build those connections further out in the community. Like if you don't know these things exist, then how are you going to outreach to them in the future? We also use it to help us, we'll go out into different communities and try to see if we can observe any substance use in the community, take any pictures. Like for example, we did one in Washington Heights that showed us that there was a local park that had a lot of syringe waste in it. We did one in the Bronx where we found that outside of a school, there were a lot of vapes and cigarette butts and tiny alcohol bottles, right? So it can just give you like an idea of the physical landscape of your community. And it also can just be like a really great way to build collaboration with your community. It can be really great activity with the coalition to build that buy-in. Photo voice is another great example. This is really great to do with youth. It just allows participants to take photos and write corresponding narratives that relate back to your overall assessment question. It's a digital storytelling and participatory action research strategy that allows community members to tell their own story and view their community through their eyes. I mentioned earlier listening sessions. Again, we don't want to discount community listening sessions. They can be a way to show the community that you care about what they have to say, right? Whether or not that makes it into your formal evaluation is up to you, but it gives the community a way to speak directly to the coalition, directly to the organization, and feel like they have a voice in what you're learning about their community, right? It can just be a really great way to get some buy-in and to get some feedback from the community. And again, it is just really important to build relationships with your community because it's really crucial to the data collection process. For example, community partners are really critical to disseminate surveys. Ronni mentioned earlier the example of a coalition that works with unhoused youth who are part of the LGBT community. Their community partners let them conduct their surveys at their drop-in sites, right? Without those partnerships, they would not be able to reach that population. Involving community members can just, again, help you see the inner workings of the community in a way that the surveys alone won't allow you to see. And it builds buy-in, can help towards the overall community readiness, right? And then again, our community assessment overall, once we've collected all of our data, we should really be able to figure out who the target population is. What is the geographic area if we are targeting one? And what are the risk and protective factors? So everything that we've talked about today, all of these data collection tools should be culminating in these 3 questions, right? In the answers to these 3 questions. And then finally, your assessment should include, and again, this is also going to be so particular to your grant, to your overall requirements, but these are some of the things that we often see included in a community assessment. I just want to make sure I'm not missing anything in the chat really briefly. Cool. The definition and description of your geographic area, the demographics there, right? You want to know what the community looks like as a whole, rather than just before you dive into your population of focus. So you just want to know, is it a rural area? Is it an urban area? How many people live there? What is the geography of the community like, right? The actual needs assessment will be the data pertaining to substance abuse in your community. So that will be your prevalence data, your consequence data, your data relating to the underlying conditions. The resource assessment, again, this is where community scans can come and help, can be very helpful. I failed to mention community mapping, like resource mapping, asset mapping. I actually have a training about that on how you can use Google Maps to do that. So you're going to want to see the resources that exist in your community, identify lacking resources, existing resources. Again, finding those existing resources can really help build partnerships overall. Community history. What events have taken place here that might inform the issue? Did the local high school have a really big case of overdoses recently that we could build off of, right? And then our problem and goal statement. So what issue are we tackling and how are we going to tackle it? Are there any questions? I know we have 2 minutes left. Ronni has put our evaluation in the chat. If you could please do that today, that would be great.
No, that's not the evaluation.
Oh, so sorry.
Those are the New York State County opioid quarterly reports. Just
so
for
sorry.
data.
My bad. I saw you had put the attendance in, so I will drop the evaluation because I know we're in our last 2 minutes. But are there any questions while we do that? Oops. Sorry, I'm having difficulty copying it. Why is it not letting me? Okay. And again, this is really going to, what your final assessment looks like depends on what your grant needs. And if you have any questions and want to contact us, please let us know. And please try to fill out the eval. It lets us know how we can improve this training in the future and gives us an idea of what we can improve upon.